Hello, everybody. So today we are going to be talking about Transgender Day of Visibility, and I will be having Lisa and Britt joining us as guests. Here we go. Hmm. Hello.
Paul.
How are you?
I'm all right. It's nice to see you.
Nice to see you.
I love the colors you have going on.
In my wall or the shirt?
Both, the
Oh.
combination.
Thank you. We are just waiting on Lisa. It looks like she's in here. Let's see. Oh, here we go. Hello.
Hi,
How
Hi,
are
Lisa.
you?
doing good. How are you?
Good. So it looks like we have some people, so let's get started. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to our social media platforms, and we cover various topics about HIV, STI, and sexual health practices. The community health team is here to educate and support you. So, as I mentioned today, we're going to be talking about Transgender Day of Visibility. Um, so, thank you, Lisa and Britt, for joining us today. Um, so, we wanted to take some time to discuss the importance of today, to learn more about your experiences, as well as the ways Whitman Walker Health can support and provide resources to the trans community here in DC. So, Transgender Day of Visibility is an international event that is held annually on March 31st to recognize the resilience and the accomplishments and progress made by members of the transgender community. Today, we celebrate not just trans individuals amongst us, but the ones who have done work to the struggles and trans community faces and advocates for in our community. So, Lisa and Britt, today we have a few questions to ask you, and we also ask our audience to ask us questions in real time. So, our first question is, what is the history of Trans Visibility Day?
Yeah, good question. Lisa, would you like to take this or would you like me
I
to?
want to put something in the beginning and then you can add some more details if you want. Okay, so each year on March 31st, LGBTQ advocates recognize that International Transgender Day of Visibility as an annual event dedicated to celebrating transgender people and raising awareness about discrimination about and other issues affecting us.
Perfect. Yeah, I think all I would add um, a little bit of the history. I am from Michigan, and the person who started this day for trans communities, her name is Rachel Crandall Crocker, and she's a Michigan-based white trans woman and psychotherapist. And it was back in 2009 that I think she did like a lot of the work of organizing communities in Michigan, across the US, and globally to kind of have this day so that there was more than one day, more than Trans Day of Remembrance, which happens in November and is often to commemorate the lives of our trans siblings who we've lost through the year. So this day is instead to like celebrate and bring like liveliness and joy for all that the trans community brings. That's my understanding and what Lisa said.
Perfect. So, why is Trans Visibility Day important to you?
International Transgender Day of Visibility, also called TDVOV, Transgender Day of Visibility, is an annual holiday occurring on March 31st. And also, as we already know, is dedicated to celebrating transgender people, as I said in the beginning, raising awareness of discrimination faced by transgender people worldwide. So as well as celebration, as there many, wonderful transgender women over the around the world and here in the United States as well.
Yeah, thank you for that. I think that's a great point, right? Like uplifting a lot of the work of trans women all over the world, especially. I love that this day brings attention to some of the efforts of our ancestors, of people who have really laid the foundation, who like gave their lives for all of us to have the rights we do have. I also think visibility is important. For individuals, each of us gets to decide if we want visibility or if we celebrate it, what it means to us. Um, I think for some people, like a first Trans Day of Visibility to be like out and proud, or if that is something you can access, feels really meaningful. And I know that it's not always celebratory for everyone. Visibility is not always chosen. Sometimes it's not safe or accessible. So I think the day itself is important in that it's slow, like over time, I think it's brought attention to what's happening for trans folks globally. And that to me is meaningful. The more like awareness and action that can come from that, from non-trans people, that feels really meaningful to me.
Perfect. So, what are some issues that are affecting the trans community?
So there are so many. So I'm going to start with health. And as we already know, transgender people face enormous health disability, including a surging rates of HIV infection, lack of primary care, including individualized, medically necessary transition-related healthcare, and high related of attempt suicide. And also, one of them is economics. As we already know, transgender people bear the economic consequences of discrimination, including high rates of poverty and unemployment, and also, as we already know, discrimination in education and homelessness around the US. So, trans people are the most trans twice are likely to live in extreme poverty, earning, earning under 10,000 a year. So, which mean also Latin transgender people facing three and half of the time, and Black transgender people facing three times. So the poverty rate is also for general U.S. population a problem here in the U.S. And also one more is safety, and we already know transgender people and Black transgender women specifically are experiencing the high level of physical violence, and this is particularly true among transgender people participating in on sex work and other informal or criminalized economies. So brutal murders of transgender women occurred in the such um, alarming regularity, often with little response from law enforcement. That the American Medical Association declared violence against transgender people as an epidemic in 2019. So also we already know civil right recognition and respect for the civil rights of trans people is critically important because their legal needs span many aspects of life. Also, their needs include to identity documents that I accurately reflect who they are, who we are, and protection from, employment discrimination and also to Latinx people, including immigration right, and also education for trans Latin community is one of the problems. It's happening here in the U.S. It's also something is happening in our countries too, and we have like less people, we have not too many person trans in the in the school. Not too many people go to the school because the discrimination is really how can I say that word? Yeah, it's discrimination a lot of in those spaces. That's why I believe personally, uh, um, the most important part to me is education, and I believe discrimination is one of the things. That's why trans community is not going through the school because um, many things is happening. So anything else, Brett?
You shared a lot. I think right now there's a couple issues that have become really public. For example, like, can trans people play in sports? Like, having this simple act of, like, athletics in school question because you're trans, like, that feels like a big issue. It's a growing issue. Not being able to talk about gender identity in your classroom in the state of Florida, for example, that feels like a scary time. I know internationally, trans rights look very different. It's not safe to be openly trans, or like in the UK, people who might, young people trying to access hormone blockers are being denied that. Yeah, I think there are a lot of issues that face trans folks, and Lisa did a great job sharing more about that.
Thank you,
Yes.
Brett.
So, what are some resources that Whitman-Walker offers to the transgender community?
Whitman-Walker is offering many kind of resources. We have gender affirming, gender affirming care, uh, public benefits, primary care, and specifically HIV care, HIV and STI testing, PrEP, post-exposure prophylaxis as well, and maybe Brit has sent something else. If I forgot something.
No, that was great. I can talk a little bit of what our gender affirming care looks like. Lisa knows this too. We have a department of gender affirming care. There are three of us that work in the department. And we work most closely with our medical patients who are moving through a process for medically necessary gender affirming surgery. So patients get a navigator who kind of walks alongside them, helping to make sure people have access to the, like, required paperwork. If you want your insurance to pay for your care when you're trans, you often have to prove things about yourself. And so Whitman Walker has staff in place to kind of walk folks through and make it easier. We also have like a legal services team that helps with name and gender change clinically. So you might have already said that, sorry, but they can also help people to understand their insurance and what their coverage for gender affirming services or procedures might be. We have a policy, education, and like advocacy arm. So we're kind of growing our position in different advocacy spaces, trying to make sure we're standing up for the rights of our trans communities.
Perfect. So I will add that we have all this information on our website. As well, if you go to our highlights on Instagram, we have a lot of this information and resources as well. So, what are some ways that our audience can support the transgender community?
It's a good question. Lisa, do you want to go first?
You had to do it's your turn. I didn't do that. That I couldn't find something
Yeah.
because to me it was like a little confused. But if you can just share for me anything, it's
Yeah.
going helpful. Thank you, Brit.
I think our audience can share this live if they learn something. They can share information about Whitman Walker with people in their life who may come to them asking about safer spaces or accessing medical care. People, if they're trans, they can, tune in, feel affirmed, hopefully feel supported, like, reach out to us if they need support. And if we have non-trans audience members, maybe they feel encouraged to take some solid action in like any way possible, right? Like, give money to a trans person, watch trans media, listen to trans stories. I like to encourage non-trans people to question their gender and think about how gender impacts their life. Um, there's a lot of ways to do that, but those are just a few.
Perfect. So for our final question, are there any individual organizations or events that you'd like to share that our audience can use to promote the visibility of the community?
Yes, I have. Yeah, I have so many writing here. So I have Casa Ruby, K Society, Trans Latinx DMV, Nova Salud, Virginia, Empodérate la Clínica del Pueblo, and in addition, uh, recordemos que Whitman-Walker tenemos 3 personas trans latinas acá en la clínica que somos bilingües. Una de ellas es Alexa Rodríguez, su servidora, y otra persona que no quiero decir el nombre porque I didn't ask her if I could tell her name here, but you know, so we are bilingual, and Wima Walker, and we have these spaces for every trans in around DMB. If you want to join, just call us to make an appointment. Also, it's a friendly reminder to, if you want to get tested for HIV and STI testing, remember it's for appointment only, and you have to call 797-4439. And if we don't answer for any reason, you can just leave a voicemail. And in the next 24 hours, we are going to call you back to help you to get your appointment to get tested. And thank you. And Brave.
Yeah, I love those groups. I think Trans Lifeline is an incredible resource for trans communities to have like crisis and mental health support. I think in Baltimore, there's a group called Baltimore Safe Haven, and they are housing Baltimore's trans and queer community. So they're doing great work and very similar to Casa Ruby. No Justice, No Pride houses trans folks in the DC area as well. There's a group called Smile in the DC area that provides kind of virtual support groups as well. I believe I'm going to misspeak on this, the Wanda Alston House just also started up looking for like elder housing models. If folks, yeah, I think wherever you are in your community, there are probably groups doing work for trans and queer people, and you can find them and give money to them and uplift the work that they're doing.
Yeah, and remember just one more time, if you want to get tested for HIV and STI testing, you can just call us it's just by appointment only. You have to call us 202-797-4439. Remember, 202-797-4439. And if you need treatment, you have to call the hotline from Wima Walker. It's 202-7456-1752. And if we don't answer you phone call, if we miss your phone call, you can just leave a voicemail, and we can just give you a phone call back, and we can help you to get the appointment to get the HIV and STI testing.
Perfect. So before we go, we wanted to give you a few reminders about COVID-19 as well as the vaccines. So the CDC recently relaxed mask guidance, stating that you mostly don't need to wear a mask unless you're indoors in crowded spaces. Um, if you've already been vaccinated, you've already taken a very important step in preventing yourself, your loved ones, and your communities from the illness. But the Omicron subvariant has soared recently across the United States, and there is, if you want to wear a mask, don't feel bad about it. Okay. So if you haven't been vaccinated and you're looking for an appointment, Whitman-Walker does have the COVID-19 vaccine available. Everyone ages 12 and up are eligible to receive the Pfizer, and everybody ages 16 and up can receive the Moderna. So please reach out to us at 202-207-2480 to make an appointment. And for DC residents, you can also find information on the vaccine and eligibility at vaccinate.dc.gov or by calling 1-855-363-033. For Maryland, you can go to covidlink.maryland.gov or by calling 855-634-6829. And for Virginia residents, you can visit vaccinate.virginia.gov or call 877-829-4682. So if you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantine, and social distancing. And it's very important that if you consider getting the vaccine, discuss precautionary measures and be mindful of masks. So remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, as well as at NoFilterDC and Real Talk, that's .dc_ for the most up-to-date information. And for more general COVID-19 resources, please call us at 202-797-4439. And as Lisa said, you can also call that number for HIV and STI testing. So thank you so much for joining us today, and we will see you later.
Thank you.
Thank you, Lisa. Thank you, Paul.
Thank you, Brit.
Bye.
Thank you, Paul.
Bye.
Bye.